8 different techniques with varying force, from the most gentle you can do to the more, I don't want to say rough, but to the more advanced type of techniques. Medical doctors don't believe in chiropractors. Who thinks that? Does anybody here think of that? Yeah. That's a very common misconception, because over the years, in fact until 1989, chiropractors and medical doctors had a big fight, and medical doctors thought chiropractors were quacks, and in fact they actually termed it as quackery until 1989. So it's only been a few years ago, really, that they started working together. But I work with neurosurgeons, neurologists, MDs, DOs. We work all together to give better health care. And what we're seeing is chiropractors are starting to become a more primary physician. I see people first a lot of times now, instead of them going to an MD and getting referred and things like that. And then another one I don't have up here is you don't need a prescription to get chiropractic care. I've been hearing that one a lot, and I haven't added it in yet, but you don't need a medical prescription to get chiropractic care. I'm a doctor. You can come in, we can diagnose you, and give you treatment. All right, so what is chiropractic? That's the big question. Nobody really knows what that is unless they've come in and seen me, and I educate every new patient that comes in. But chiropractic uses adjustments and physical therapy to increase joint mobility and decrease inflammation. I know it's a lot of mumbo-jumbo, but I'm going to explain it nice and easy. Chiropractors look for something called subluxation. Has anybody heard of that term? Subluxation. Even the people that have been to chiropractors, have you heard of that term? Anybody? No? One? Maybe? Okay. That is what I deal with in the spine. And most chiropractors don't educate on that. They just say, okay, come here, I'm going to adjust you and get you better, and then they say, okay, I'll see you next week. But this is why I educate on it, because if you understand what that term means and what I'm working on, then when you are out and about doing your daily activities, you have a better likelihood of helping yourself and not injuring yourself. Subluxation is based on 5 things. Number 1 is restriction of mobility. All right? Restriction of mobility. It means you can't move, turn, and bend like you normally would be able to. Does anybody know anybody that might be restricted, including yourself? Right, right. That's the beginning. People generally don't think about that as a symptom or something going on, but, I just got this little thing in my neck, this little crick, my low back, this little tightness, whatever. That's the beginning of this. Step 2 is symptoms elsewhere in the body. This is my favorite phrase. Oh, it's just my normal pain, my normal headache, my normal everyday whatever. But that is a sign. If everybody here drive a car, right? Okay, I love this analogy. But if you had your car, you're driving it, and a little check engine light comes on and it's flashing at you, do you go right away to get your car checked? Do you say, oh, it might go away? Maybe it'll go away? Right? That's what most people do on these symptoms. Oh, it might go away. It'll go away. It'll be fine. But then eventually it turns into more, and that's what happens. So then your muscles become tight and go into spasm. I'm sure people have had that experience. All of a sudden now it's not just a tight spot or a restricted spot. Now it's spasming and it's starting to ache a little bit. And then after the muscles spasm, they become swollen and inflamed. That is when I see people, generally. Now they should come in up here at the restriction part, but they don't know that. So once they become swollen and inflamed, I love this statement. I just bent over to pick up a pencil and my back went out. I don't know what happened. Well, it wasn't the pencil, it was all this other stuff that led up to that. Okay? So swelling inflammation is what I like to call a crisis of pain. I have this massive migraine out of nowhere, those type of things. And then finally is degeneration. Does anybody here know what degeneration is? Anybody heard that phrase, that term? All right. Degeneration, I'm going to show you what it is because it's really important to prevent that from happening. Does anybody know that they can prevent degeneration? Anybody? Susan knows.
Keep moving.
Keep moving, right. You're right. Keep your joints from being restricted, right? Okay. So subluxation degeneration looks like this. This is a normal joint. There's 3 things I want you guys to see. This right here is the disc space. It's nice and thick. This right here, the white part is the bone. It's nice and smooth. And then the yellow part is the nerve. It's nice and thick. If you have those first 5 things happening, you'll move into phase 1. And there's not a ton of difference, but it's misaligned. It's not lined up quite right. And then the muscles around it, which you can't see here, they're starting to get tight and tender. Then it turns into this. That's phase 2. That looks familiar to anybody? Does that look familiar to anybody? Decreased joint space, so now the joint is thinner and the bone starts to grow these little bony parts out called spurs. Okay? And then finally it looks like that. So my job is to prevent that from happening by keeping your joint moving properly. Okay? Now, if you have kids, grandkids, anybody like that, can you think of somebody that you might want to prevent that from happening, right? I mean, just really think about it.
Can we ask?
Yeah, go ahead.
How can you? I mean, you said your job is to stop that from happening.
Mm-hmm.
What do you use?
Adjustments. Basically, we look for this restriction. So this right here, we look for this restriction of mobility. And when a joint is restricted, we can take that joint and actually get it to move. Are you familiar with the spine at all?
Sure.
Okay. So the facet joints can become restricted also, and those are the joints in the back. So if you look at the spine, there's the front joint, which is here. The facet joints are back here in the back of the spine. And if they all become restricted, and any one of those can, left, right, or the front, which is the actual disc here.
So you talk about really, in this case, you talk about a joint where you have a mechanical thing that, you know,
Yes, it's all mechanical.
This, like a knee or a hand. You're not talking about the spine.
No, I'm talking about the spine too, because you can have mechanical issues going on with the spine also. Like whiplash injury, here, I'll show you. It's based on time and gravity, okay? So if you have something, your spine's not moving properly for a long period of time, then that is going to degenerate over time, right? So it doesn't happen overnight, it takes time. And so how bad is the joint moving for how long? So how does that actually happen? Structural instability. So if you have somebody that has 1 inch of leg discrepancy, then they're going to stand crooked, and now the spine is structurally unstable. That's why they use leg lifts, heel lifts.
Well, I mean, as you age, things are, there's not everything would be aligned as you're aging. So this is something happening with everybody.
Yeah, you will degenerate over time, but why would only
what
one?
I'm say is how you stop degeneration when this is part of the aging process.
I'm not talking about the entire body. I'm talking about one joint. So if you have an accident or injury or a long-term mobility issue, let's say you look down and text, all day, 6 hours a day. You type on a computer and your head's forward all day, and you're creating this instability in your upper part of your spine. Then it can develop degeneration in 1 or 2 joints. So if degeneration happens in a widespread, throughout the whole body, you have a bunch of different arthritis that can happen like that. I'm not talking about that. I'm talking about instability degeneration. So if one joint is not moving like the other ones, that one joint will degenerate.
So you're talking about degeneration caused by mechanical imbalance.
Right. Right.
It has to be an accident, not due to aging.
No, not due to aging. No, it's not just due to aging. No, not at all. Yeah, it's mechanical, and it will happen from a one-time trauma or multiple trauma. And I have that coming up. So right here, one-time injury, whiplash, cervical compression, or repetitive trauma. So yeah, it doesn't just. I'm not talking about as you get older, your whole body will, joints will degenerate and that sort of stuff. But people think as they get older, they should end up in phase 3. I've had people say, I'm just older, I'm going to end up in phase 3 degeneration. But you shouldn't, not your whole body, right? Right. I mean, your joints should outlive you if they're moving properly. Now, they might not look as good as they did when you were a teenager, right? But if you have one joint that has an issue going on with it, that joint will degenerate, and I'll show you what I'm talking about. So structural instability here, there's going to be more pressure on this side than there is on this side, right? Okay. So if you have something like that, you can degenerate in one joint in your spine, and the rest of them look good. So that's what I'm talking about. If I can get that joint to move properly and all the muscles around it to work properly over time, then we can actually heal that section. Now, once you get so far, you can't reverse it. And I'll talk about that in a second, too. So here's your repetitive injury, people working on a computer, people texting, and that's what their head looks like. It's really forward, and if you look at where her head is, it's way out in front of her shoulders. People use a lot of computer time. They watch TV a lot. The average American watches TV over 8 hours a day, they say now, which is pretty crazy. I mean, I don't, but I know a lot of people do. So when you watch TV, your head a lot of times, how many people sit straight up when they watch TV? Anybody? I don't. I tell my wife all the time, would you sit up? Right? So their head is generally forward and it's down, and over time that can cause problems. Another problem is sitting. When you sit, slouching a lot of, that can, a lot of times you can slouch and that'll create instability also.